Well, as you know, Barack Obama wants to provide nationalized health care for the United States. Now, we've had nationalized health care in Great Britain, had nationalized health care in Canada. In your opinion, what is the benefit to the American people with nationalized health care?
Well, we've had nationalised healthcare. We've had almost a state monopoly in healthcare in the UK since 1944 when it was brought in. It was brought in, by the way, at a time of massive state control of everything because we were in the middle of the Second World War, right? It's incredible that you are seriously thinking of bringing it in now at a time when people have seen that the government isn't really the solution to these things. What's the experience that we've had in Britain of state healthcare? Well, the most striking thing is that it involves a lot of rationing by queue. You need a hip replacement, come back next November. You need a particular kind of drug, I'm sorry it's not available, it would be too expensive. So you then have no choice as a consumer. You have no ability as a patient to shop around and say, well, I'd like to go somewhere where I am going to get the treatment that I need. Because there is, as I say, nearly a total monopoly, and you're expected to be grateful and put up with whatever you get.
Well, you bring up a good point. Your healthcare system, the NHS, has basically a group of government bureaucrats who decide what patients will get drugs and treatment. Now, the rationing body is what they call it. Is that a natural consequence once nationalized healthcare is implemented?
If you have a nationalized healthcare system, somebody has got to allocate resources, and if it's being done by the government, and if it's being done in a way that excludes any price mechanisms, then the only way of doing it is rationing by queue or simply by withdrawing drugs or withdrawing medication that would be deemed too expensive. We have a body in the United Kingdom that's known as the National Institute for Clinical Excellence. It's not even elected. It's not even politicians doing this, right? Utterly unaccountable. And this committee, this bureaucracy, makes literally life or death decisions. It tells you whether you can get your breast cancer treated, whether you can get the right kind of medication for heart disease or stroke or whatever it is. And if you don't like it, there's nothing you can do about it. Now, because the NHS is so big, because it's such a sort of elephant getting into the rowing boat, there's very little in the way of private healthcare. Private healthcare has been squeezed right out to the margins, and only very, very wealthy people can afford it. There's no competitive market of private insurers. A consequence of that is if you then, in order to try and get the medication that you're being denied by the NHS, if you then go private, they take away all the NHS treatment because that's how hostile the mentality is to any private sector involvement.
President Obama wants a public option that he says will only compete with private insurers. Isn't that how Canada started? And do you think that would eventually lead to a single-payer healthcare system in the United States?
My understanding is that the Canadians began with something similar to what is being proposed in the US. In other words, that there would be just one government option next to all of the others. But of course, once you start down that road, you take on a momentum. And if one system is backed by the taxpayer and the other one isn't, that is not a fair and competitive market for the others. And eventually, as has happened in Canada, the private providers get completely squeezed out and you end up effectively with a state monopoly. And it's at that stage that the standards really start dropping because at that stage there's no competition, there's nothing that the patients can do about it.
What impact has national health care had on your nation's economy?
Well, the first thing to say is that the results produced by a socialised healthcare system, as we have in the United Kingdom, are demonstrably inferior to the results produced in a market system such as yours. If you look at survival rates, what are your 5-year survival rates if you get cancer? What are your survival rates if you get heart disease, if you get stroke? Plainly, you would be better off in the United States than in the UK. I mean, that's not my opinion. That is a question of straightforward statistics. What's the cost of that to the economy? Well, it's very difficult to quantify, but when people say National Health Service treatment is free, the one thing they're not taking into account is if you are told that it's going to take a year to get your knee operated on, which is literally it is a 12-month waiting period if you need an operation on your knee, and you're not working because you're a manual worker and you need to move around, that is a huge cost to you in terms of lost income and to the economy more widely. And that's not even counting the direct cost of taxation, which is now the single biggest component of our national budget.
Fantastic. Knowing what your country knows now, about nationalized health care. Would the citizens go down that road again?
It's almost unthinkable that we would begin with a national health system today knowing what we now know about it. Now you might say, then why do we keep it? Why is it that we keep this extraordinary thing when we can see that it is failing, that it has waiting lists, that it has rationing, and that people, thousands of people every year, are dying in hospitals because they're picking up conditions that were unrelated to the ailment that they went in to have treated, right? Why would any rational, sane people cling to such a system? The answer is, once you get a system like this, it is almost impossible to get rid of it because so many people then have a vested interest in the status quo. Let me tell you an amazing fact. The National Health Service is the third biggest employer in the world after the Chinese Red Army and the Indian National Railways. 1.4 million people work for the National Health Service in the UK. And you know what? More of those people are managers than doctors and nurses. There are more bureaucrats than medical staff. And that is a huge electoral block, which makes it almost impossible for any government to get rid of this system. People, with all its failures, people cling to it almost like a battered wife sticking to a violent man because she has given up being able to think of any better alternative.
Wow. Now, you mentioned, having to wait for surgeries. What do you have any idea what the average wait time for an appointment with a doctor?
Well, this was the most extraordinary thing. At the last general election, it came out, the government had decreed that you should at least see your doctor within 48 hours. So they couldn't make any promises about waiting times for operations or courses of chemotherapy or anything like that, but they could at least, they thought, say, well, you will get to see your GP within 2 days. It then turned out, and this came to light during the election campaign, that in order to stay within the letter of the government guidelines, doctor surgeries were refusing to take appointments. Because if they couldn't fit you in within 2 days, they would simply not take the booking. So you would ring up and say, look, I've sprained my ankle, I need to come and see you. And they would say, we can't take your call today, please call back on Friday. Which is a really classic example of how governments run things badly. How decrees from the centre never have the same effect that consumer choice would have. You're using a sledgehammer to miss a nut. You're having all the unintended consequences, all the bad things, without actually the intended consequence.
So your advice to America is to stay away from nationalized healthcare.
If the American system of healthcare is as bad as some of its detractors claim, why is the whole world queuing up to try and get into the US for medical treatment? Now, I am not saying that the American healthcare system is perfect. No system in the world is perfect. Man has fallen, and it's not for us in this life to achieve perfection. And there are lots of things I'm sure that you could do to make your system more efficient and to strengthen the power of the consumer within it. But the basic fact of having choice, of having that contractual relationship with the provider as the patient, that if you're not satisfied, you can claim redress or you can go somewhere else, that is a really precious commodity. And if you throw that away, I think you'll regret it.
Great. That's all I had.
Great.
Thank you. Fantastic.
You're very welcome.